Take Care of Your Body by Rye with your host, Rylan Rosano. It's spring. Oh look, beautiful flowers. No, wait, it's allergy season. Stay tuned in to see what's next.
I hope you're smiling because it's me, Rye. Today, I'm here with a very special guest. She's department chair and director of the Food Allergy Center of Excellence of Cleveland Clinic in Ohio, allergist and clinical immunologist, Dr. Sandra Hong. Thank you so much for joining me.
Oh my gosh, thank you so much for actually asking me to be on the podcast. I'm very excited to be here.
Thank you so much. So I want to kind of touch on some important aspects of allergies. It's spring. I know I'm suffering from allergies, and I know a lot of my listeners are for sure suffering from allergies. So let's kind of have a conversation about allergies. Are you ready?
Oh, absolutely.
Okay. So what are the most common types of allergies that people experience?
Yeah, so the most common are environmental allergies. I like to break them into kind of the seasonal stuff and then the perennial year-round things. So our seasonal stuff is exactly like you said. I usually break my seasons into kind of the national holidays. So up until it goes from winter until about Memorial Day is tree season for most of the country. And from kind of Memorial Day to Labor Day is grass season. And from Labor Day to the first good snowfall or frost is actually weed season. But then you've got on top of that your year-round kind of allergens. And those are things like your pets at home that are furry and the mold, cockroaches, and dust mites. Those are kind of your year-round things that can bother you even in the dead of winter.
Wow. So there's a lot of things that can really trigger people. And I think it's really interesting because it's very individualized. So it depends on the person. Like one person can experience, I'm sure, all of those things that trigger their allergies, and then only a few. So it's like, oh no, my pet could be making my allergies worse.
That's exactly it. Or some of the times people, even if they're not allergic to their own dog, say, when their dog goes outside to roll around in the grass during the summertime, when your dog comes in and you decide you're going to sleep with them, you are basically just sleeping with the grass pollens from outside. So even if you're not allergic to your dog can definitely make your allergies worse if they go outdoors.
Wow, that is crazy. So how can someone differentiate between an allergy and a sensitivity?
Yeah, so that's a tough one. Allergies very frequently, you'll actually have them happen seasonally, and they come along with more kind of typical symptoms of someone with allergies. So usually when people have allergies, they're kind of stuffy in their nose. They'll actually have drainage. They can be really super snotty, or they get drainage down the back of your throat. And then with allergies, I feel that there is a lot more sneezing and itching. The itching can actually be itchy eyes or itchy ears. Sometimes kids will do this allergic salute where they kind of rub their nose with their hand, and they'll get a little crease on the top of their nose because they're always kind of wiping their nose because it's itchy or it's drippy. Sensitivities, it can be, there's something called vasomotor rhinitis or non-allergic rhinitis, and that's actually when it's more irritants are bothering us with symptoms. And 30% of people that think they're allergic to allergies, we skin test them and there's nothing that they're allergic to. Oh. And it's more like irritants, like smoke can sometimes bother people, or dust, or perfumes can actually cause people to have similar symptoms of allergies, but we can't skin test and we couldn't start them on shots because they're really not allergic to it. It's just irritating our sinuses, if that makes sense.
That makes so much sense. So it's very interesting because, so for example, I'm someone, I love perfumes, but when I smell certain ones, then of course I start sneezing, my nose is very aggravated. So it's literally just what you said, which I think is kind of interesting.
Exactly. That's exactly it. So it's very confusing to patients because they come in with just all the symptoms, usually not as much itching, but all of the other stuff. And we'll skin test them and it comes up negative, and it's very confusing, but exactly that. It could be it's irritating us.
So what are some of the latest advancements since we're talking about allergy testing and, the treatment?
Yeah, so with allergy testing, interestingly, testing hasn't changed that dramatically. It is typically the ways we look for allergy testing is either one of two ways. One is where we do scratch testing. And the great thing about that is you get immediate results. They're actually more sensitive than the blood work. And we're able to kind of give you plans and treatments based on what you're allergic to immediately. So with blood work, they can actually we can order blood work to look for allergies, and it can give us an idea of what might be giving people problems. It takes a little bit of time to come back. They're typically not as sensitive. Most people don't order as many things as we were able to with scratch testing, but it can absolutely be helpful. The one confusing thing is sometimes the scratch tests and the blood work may actually say you're allergic to things that you're not. So having a really good history is important to kind of get a really good idea if someone's truly allergic. Treatments are kind of broken down. I like to break them down into 4 different ways. One is avoidance. And it may sound really hard to avoid something like a tree or grass, but avoidance techniques. 2, we've got medications, and a lot of them have gone over the counter. So a lot of really great stuff is out there for patients. 3 is actually kind of allergy shots, which have been around since the early 1900s, but allergy shots. And then 4 are actually something called sublingual immunotherapy. And that's the newest of the treatments out there, where we basically give the purified protein of what you're allergic to. And the results are similar to someone who gets allergy shots, but they're able to do them at home every single day. They just take their little pill. The tough thing about that is that there are really only a handful of things available for sublingual. You can do dust mites, you can do grass, you can do ragweed, but that's it. So if someone has those things that are bothering them, it's a great option for them.
Wow, that is awesome. So something that you added that I want to touch on that came off the top of my head is, so you said that sometimes it will show that someone's allergic to something and they're actually not really allergic to that. Have you seen a lot of false positives with celiac testing or gluten sensitivity? I know you probably work a little bit with that, as well as peanut allergies. I know for sure you work with.
Yeah. So from a food allergy standpoint, the testing specifically, when I talk about food allergies, I'm talking about, they're called IgE mediated, but basically those are the immediate reactions where someone takes a bite in something and they can be covered in hives. They can feel like they're short of breath. They can actually pass out from it, and it can be life-threatening for patients. So that's kind of the type of food allergy I'm talking about, as opposed to a different immunologic way of working like celiac. So the testing that we do for food allergies, and peanut's probably one of the most common food allergies, yes, that's part of the problem with it. The great thing about testing is typically we don't miss allergies. So if you skin test someone, we won't miss an allergy. But when you have the sensitivity that great, then it sometimes can actually kind of be, it could show that they have positive test, but they're not truly allergic. And that can happen up to a quarter of the time, 25% of the time.
Wow.
So it's really important for those individuals. to be aware. The tough thing about celiac, and I don't have as much of the data since this isn't something I truly care for regularly, but part of the difficulty is missing the diagnosis. Like sometimes the testing isn't as good if, say, they stopped gluten from their diet. That can actually kind of change your results of that. So sometimes doing a biopsy where they take a little piece of the tissue, kind of the GI tract, the duodenum, can give them a good idea. And then there's also genetic blood work that they can do to see genetically if you're at higher risk for it.
Wow, that's so interesting. So my next question, you kind of touched on it. How can allergies affect overall health and well-being? I know you kind of just mentioned it can be very life-threatening sometimes.
Yeah, so with food allergies, absolutely. So food allergies, there's so much involved in it. It can absolutely be socially and emotionally devastating for patients and families. It absolutely can cause life-threatening reactions and with it anxiety for the patients concerned that either they have to use their epinephrine because they don't want to, or the fact that they could have a life-threatening reaction. But if you think about a lot of the holidays in the United States, they're all filled with candy and cookies and Halloween and if you celebrate Christmas, there's tons of desserts, and a lot of times, like a lot of the food allergies are part of that, and the things that we're trying to avoid. So it becomes really difficult. I would say from the standpoint of like seasonal allergies and environmental allergies, it's interesting. They've done studies looking at the quality of life for patients that have severe allergies, and it compared to someone who had like open heart surgery, that people can have that much difficulty. Like they aren't able to focus, they're not able to concentrate, they're actually feeling absolutely like they've got that they can't focus either at work, or if it affects patients where they have asthma, like doing sports or being at gym, they can actually have difficulties with breathing and missing school from that standpoint or work. So, allergies absolutely can be very, very, very difficult for patients at so many different levels.
So that's really interesting that you said that. So I'm going to kind of share a little bit about myself with you. So I've had asthma since I was 2 years old, and my triggers are mold, mildew, pollen, dust, really all of the main, allergy triggers. So growing up, when I was in school, the mold and mildew, or when it would rain really bad, because I live in South Florida, it would offset my asthma. And the thing about my asthma is it would often quickly turn into pneumonia, to the point where I would be in the hospital a lot, on a lot of steroids and medications, and just I would have to manage it. And I remember I had teachers not really understand that it's something very severe. I had, teachers that were like, why are you missing school? Or friends that would be like, why are you not at school? But the thing about allergies or asthma is one day you could be okay, the next day it can offset you and you're not feeling well. So I love that you kind of shedded a little bit of a light on that.
I think asthmas can be extremely difficult, and that's kind of the definition of asthma, where 1 minute you can absolutely be fine, but if you get into a trigger, and you mentioned some of them, but other triggers can be smoke, getting sick like a virus can be a trigger, exercise, cold air. So those types of things, or like strong fragrances or perfumes, like those can be triggers where 1 minute you're breathing just fine, but then the next minute you can't breathe and you feel like you're, and one way that people have described it is kind of feeling like they have to breathe out of a straw. So, that you're, all of that you could get in is what you can kind of breathe in from a straw standpoint. And it can be not only scary, but life-threatening for them.
Absolutely.
For sure.
And another, I don't know if you've ever had patients say this, but a way I used to explain it when I was really young is I felt like my lungs were on fire. That was kind of what I experienced. It was kind of like burning and like difficult to breathe. So that's what I would call it. Yeah.
And so some people kind of listening to your podcast, one of the things that are important is like for children and adults, like it doesn't have to be truly wheezing. They don't have to hear kind of that whistling and wheezing in their chest. A lot of times they can actually just cough. Lots of coughing, persistent coughing. And so, if you notice, gosh, every single time you run, you start to cough and you're short of breath, that might be exercise-induced asthma. Or every time you get a cold, like everybody else gets over the cold quickly, but yours lingers for weeks to months on end. Yeah, that could be asthma, especially if you have a history of allergies.
Absolutely. Thank you so much for touching on that. I think that's really important for people listening. So my next question is, how can someone prevent and minimize allergic reactions in their daily life?
Yeah. So part of what I tell my patients is avoidance techniques are really important. So things like, if we're talking about the pollens, things like trees, grass, weeds, mold, typically I'll ask patients to try to exercise during times of the day that there are less pollens outdoors. So that could be later in the afternoon, after a really big storm or rain, because it kind of washes the pollens out of the air. Trying to keep their windows closed as much as possible during their tough times of the year. So they actually, you're basically not just kind of keeping it in where the pollens are coming indoors. Taking a shower after you've been outside and changing your clothes so that you're just not going to sleep with it at night. Making sure your furry pets aren't sleeping in bed with you is a really big thing. But things from the standpoint of, like, if you're dust mite allergic, patients, I typically ask them to consider getting dust mite covers for their pillows and mattress, and limit carpeting, and washing their linens in hot water and drying in hot heat once a week. Those can all be really helpful avoidance techniques, even if you have allergies.
Absolutely. That sounds like it could be very helpful. And when it comes to the dogs or even the cats, can you wipe the paws or do anything to them in case you do want to cuddle with your little furry friend?
Yeah, so ideally you would be washing them weekly. Brushing them outside can be helpful, and wiping them down can be helpful. However, if you're allergic to them, a lot of times that won't be enough, especially cats. Really interesting. The cat protein is so stable that it doesn't break down for up to 4 months.
Wow.
So even if your cat wasn't in your house with you any longer, your cat protein that you're allergic to isn't gone for 4 months. And so it can keep giving you problems until, the time lapse.
Wow, that's crazy.
Yeah.
So what are the potential risks of untreated allergies?
Yeah, so, when people don't treat their allergies, they can find themselves kind of sicker with more upper respiratory tract infections. They are a little bit more prone to sinus infections. And so that can trigger issues. It can absolutely, if you have allergies and asthma, it can cause you to have life-threatening asthma because it's not being treated. And so you're basically exposing yourself to your allergens regularly. It can have people feel kind of like we discussed before, where their quality of life isn't great. They're not able to focus. They're having trouble sleeping at night because they're so stuffy and congested. And so it absolutely can affect all parts of their life. I've also had kids that have had so much drainage from their allergies that they're nauseated, and they just don't feel like eating any longer because their stomach is full of mucus. So yeah, kind of gross. But poor things. So basically, yeah, it can lead to lots of different issues.
Wow. And I also know that eczema and different skin, conditions that come from having allergies can also be pretty debilitating, because all you want to do is scratch at it.
Completely. Yeah, no, eczema definitely is part of, the allergy kind of allergic march that kids can do. So yeah, absolutely. That absolutely causes people difficulty with sleeping because of the itch, for sure.
Yeah. Okay, so my next question is, how can individuals best advocate for themselves when seeking an allergy diagnosis?
Yeah, that's really great. I would say definitely talking to their primary care provider is really important to start with. If patients continue to have difficulties with their symptoms, then I would actually ask them to consider seeing an allergist. We have the ability to help diagnose and identify what you're allergic to, which can help kind of treat from an environmental avoidance standpoint. But then on top of it, we do have other therapies available, like allergy shots or the sublingual immunotherapy. So definitely continue to seek treatment if you continue to have troubles.
Okay, and my last question for you is, how would someone go about knowing if they're allergic to something, and how do they get tested?
Yeah, so I would say the same thing that I'd said previously. I would have you touch base with an allergist.
Okay.
And the testing is, they can either do kind of blood work for IgE testing, or they can actually do skin testing, and that can identify like whether or not someone's allergic to a food or allergic to pollens or inhalants. So testing can be very effective that way.
Absolutely, I couldn't agree more. And maybe a little bit of a bonus question. What is one thing you want everyone listening to know about immunology or allergies or just anything from your field?
Yeah, so I would want them to know that there are really exciting treatments going on for food allergies. I think that we are right at this cusp where previously we had nothing to offer patients for food allergies, up to 5 years ago. But places at, like, say, the Cleveland Clinic, we're doing early oral immunotherapy, which is where patients under the age of 4, we are really kind of making breakthroughs on being able to have these patients eating the foods that they were allergic to and truthfully probably growing out of them. And so it's really, really important to touch base with your allergist if you haven't seen them in a while for your food allergies, or if you've been diagnosed. I would say if you have a baby under the age of 4, find the locations that are doing early OIT, because there are really exciting things that can help save your baby's life.
Wow, that is awesome. I really think that's cool that, there's so much work being done where people can eat like things that they're allergic to, and a lot of different challenges I think we have seen as just a world or a community in the past are kind of being overcome in the allergy world.
Yeah. It's really exciting.
That's really exciting, and I know you're a big part of it, and I really am happy I got to introduce you to all my listeners today. I am very inspired by you. I saw some of the other interviews you did, and I'm just like, I'm honored. Like, I kind of want your autograph because you're on my podcast. You're so amazing, and it's just incredible to me, all the stuff that you do and all the people you can help.
Oh my gosh, thank you, Ron. Thank you for doing this. I think it's really important for people to, know what's out there and recognize that, there are treatments, there are ways to make things better. So thank you for taking the time.
Absolutely, and thank you so much for your time and just being here, Dr. Hong. I really appreciate it, and I loved our conversation.
Thanks.
Thank you so much for listening to this new episode of the Take Care of Your Body by Rye podcast, where I sit down with Dr. Sandra Hong, who is an allergist and immunologist, and we talk about how allergies can affect your overall health and well-being, ways to treat them, and overall how to know if you have allergies. If you or someone you know suffers from an immunological condition or bad allergies, make sure to see a healthcare provider today, because help is always out there. Thank you so much for listening, and as always, with love, Rye.